Hello everyone. Today's interesting topic is reading a radiograph. This is a contrast radiograph of abdominal region. Here we can see the outline of one of the white rounded shadow in the pelvic cavity. So this white rounded shadow in the pelvic cavity, it can be one of these following. It can be urinary bladder, it can be uterus, it can be rectum and anal canal. In female, it can also be, if she is conceiving, it can also be a fetus. But here we can't make out the vertebral column over here in the lumbar region of the abdomen. The vertebral column of mother is there, but here you can't see the vertebral column of the fetus. So definitely it's not a fetus. Here we can see the two hip bones of this patient joining pubic symphysis area, and here we can make out the two hip joints and the femur. So maybe the patient has met with some accident, so they want to rule out any injury to the urinary system. They've injected a dye through the urethra into the urinary bladder. So the urinary bladder is distended. You can see that it is distended up. Okay, it's swollen, it's oval. So that is a normal shape of the urinary bladder when it is full. So this radiograph where the dye is injected through the urethra into the bladder is called as ascending pyelogram. Why is it called ascending? Because the dye is going upwards. From where? From the urethra. From the urethra it's injected upwards, right? So it's called ascending. Now why it's called pyelogram? Any radiograph of kidney, ureter, bladder may come across the pelvis of the ureter. So pelvis of the ureter is called pyelo. So the radiograph dealing with this kind of system, that is kidney, ureter and bladder, will be called as pyelogram. So that is the reason why it's called as ascending pyelogram. So whenever you suspect any pelvic injury, whenever you think about any calculi or stone within the urinary bladder, any obstruction within the bladder, any stricture, tuberculosis, any luminal defects like polyp, urinary bladder carcinoma, transitional cell carcinoma, whenever you suspect any defect in the urinary system, especially the lower urinary tract, which includes the bladder and urethra, during those situations we'll do the ascending pyelogram in order to rule out any luminal defects. Here we can see the bladder is swollen and it is tilted towards the left side of the patient. The right side there is enough amount of space. So this bladder, we can see the catheter also inside the bladder. Okay, you can see this tubular architecture lower down. Yeah, that is the catheter placed in the urinary bladder. So this radiograph can also be called as cystogram. Cysto refers to bladder, gram refers to radiograph. Cystogram because bladder is visible. More precisely called as ascending pyelogram. Thank you for watching and learning from Logic Medico.